Hi everyone. Today's video we're going to talk through what happens when mom chooses to get an epidural during transition, the most intense part of labor, typically around 7 to 10 centimeters dilated. Now, while epidurals are very effective for pain relief, getting one during this stage of labor can feel overwhelming. So let's break down what you can expect in terms of consent, preparation, and the actual process, so there's no surprises. Even during intense labor, informed consent is a must. The anesthesiologist or nurse anesthesiast will quickly explain what an epidural is, the benefits, pain relief, relaxation, sometimes better progress, the risks, drop in blood pressure, headache, sometimes uneven pain relief, and the alternatives like IV pain meds or continuing without medication or nitrous oxide. You'll be asked to verbally agree and sometimes sign a consent form. If it's a fast-moving labor, this part may be brief, but they'll still check that you understand and agree. Now, for preparation. This part takes a few minutes, and it may be the hardest part if you're in transition. Here's what your team will do. IV fluids are given. If not already, this helps prevent a drop in blood pressure after the epidural. You'll be helped into a sitting or side-lying position, curling your back like a C shape, chin to chest. The provider will clean your lower back with cold antiseptic solution. Then they'll inject a small amount of numbing medication in your lower back. You'll feel a pinch and a sting. Meanwhile, your nurse or doula may give you coached breathing and help you stay still during contractions. This is key to safety and accuracy. Once you're numb, the anesthesiologist will insert a thin, flexible catheter into the epidural space in your spine. You may feel pressure, but not pain. This process usually takes about 10 minutes, but can feel longer in intense labor. Once it's in place, the catheter is taped to your back to keep it secure. A test dose of medication is given to confirm placement. Then the full dose is started, either by continuous pump or in small boluses. You'll usually feel relief begin within 5 to 15 minutes, though it may take a bit longer to fully kick in, especially during active or transition labor. Once the epidural is working, you may feel pressure, but little to no pain. Your legs may feel heavy or numb, and you'll stay in bed from that point on. A bladder catheter is typically placed because you won't feel the urge to pee. Your blood pressure and baby's heart rate will be continuously monitored. You'll be asked to reposition regularly to help labor progress and ensure even medication flow. Some people can still move or even feel mild pressure with an epidural. This is normal and can actually help with pushing later on. Things to keep in mind. Sometimes by the time you ask for it during transition, you're already very close to pushing. If you're fully dilated or the baby is very low, your provider may discuss whether an epidural is still the best option. In fast labors, there may not be time, but in most cases, if you want one and it's safe to proceed, they'll do their very best to get it placed quickly. You can always turn off your epidural once you get some relief and rest before you start pushing. So to recap, getting an epidural during transition involves quick but clear consent, physical and emotional preparation, staying as still as possible while it's placed, and close monitoring afterward. It can feel intense, but you're not alone. Your team will coach you through it step by step. Every labor is different, and choosing an epidural during transition is a valid choice. The goal is always your safety, your comfort, and your informed decision. Thanks for watching.